Hello, I'm Dr. Robert Fusco, a gastroenterologist with 46 years of clinical experience. I'd like to talk to you how I treat my constipation. Of course, I do the normal things. I eat plenty of fiber, fresh fruits and vegetables. I try high-fiber foods. But I'm approaching 76 years of age, and as you get older, your bowel habits seem to slow down a bit. I think it's just aging, maybe medications you're taking, just a natural tendency towards constipation. I found that fiber alone, increased fluids and exercise really didn't work for me. So about 10 years ago, I started taking what I call my fiber mix. I want to talk to you about that. What I do is I combine Metamucil, which is a form of psyllium, a form of fiber. A different kind of fiber called Optifiber also goes by the brand name of Metafiber. I use the Costco brand, it's a little bit cheaper, Optifiber. And a stool softener called Miralax, which you may be familiar with. The Costco brand is Laxaclear, again a bit cheaper. I'm going to show you how I mix these together, my little recipe to take care of my constipation. What I do about once a month is I take an empty, dry container and I mix a cup of Metamucil one cup of Metamucil, 2 cups of Metafiber Optifiber, 1 cup, and the second cup. Those are both different forms of fiber that help constipation. Alone, they really don't work that well. But if you combine them with Miralax or Laxaclear, which is an osmotic laxative, it traps water in the stool, and just 1 cup of that, approximately, do it once a month. This will last me about a month. Close it tightly. You have to mix it for at least a minute. It's hard to mix these 3 powders in the small containers. I really churn it and mix it for a good minute. Now it's been well mixed. Each morning, before my breakfast, I take 2 heaping tablespoons of this powder, this mixture, mix it with water, about 8 ounces of water. And I like to put about 1 ounce of orange juice. It's orange flavor, but this gives a little bit of better flavor. Stir it up. You have to stir it for a while. This is a pretty gritty substance. You have to make sure it's smooth. You have to stir it a good 30 seconds maybe. And then I drink it each morning. The way this works is the fiber and the stool osmotic laxative, Miralax, Laxaclear, trap water in the stool. Your small intestine digests your food, and what's left over is a watery waste like diarrhea. If that was connected to your anus, you'd have diarrhea 24 hours a day, you'd die of dehydration. So your body's pretty smart. That liquid waste enters the right side of your colon, large intestine, which is about 6 feet long, and it goes around the colon, the water is extracted. Now, with constipation, sometimes your colon is a little bit slower, and there's more time for water to be extracted from the stool, and the stool is hard. Now, the anal opening only stretches so far. If the stool is soft, it will accommodate and fit through the anal opening. If the stool is hard, it doesn't want to come out, and they're straining and struggling. Very difficult time with constipation, hard, infrequent bowel movements. By using these two fibers of stool softener and plenty of water, this makes the stool softer, and it comes out like a snake. It's like a tubular, soft bowel movement, complete emptying, very satisfying sensation. Many patients complain of incomplete evacuation, but they can't seem to empty their bowels completely. This takes care of the problem. Now, this only works if you drink at least 4 8-ounce glasses of water every day, in addition to this one. But it works very well. I've used it for 10 years. I have hundreds of patients, literally, who benefited from it and written me letters saying how well it's worked for them. It's part of our GI practice amongst our 8 gastroenterologists. We call it our fiber mix. It has no long-term side effects. There's no actual stimulant laxative. You don't become dependent on it. It doesn't work the day you take it. It works about 3 days in the future. So you do it every day, drink plenty of fluids, maintain a high-fiber diet. I still have 2 apples every day. Try to encourage high-fiber foods. My wife makes vegetables every night at dinner. But I found this is a very satisfactory, simple solution, safe solution to treat chronic constipation. Now, of course, you have to make sure this chronic constipation is only constipation. If you have a change in bowel habits and you haven't seen a doctor, you should first consult with your physician to make sure there's no problem with your colon or obstruction or disease. Once you've had your colonoscopy or whatever and been evaluated, and your doctor says your colon's fine, it's just constipation, and simple things don't work, I suggest you give this fiber mix a try. I think you'll be very happy with it. Dr. Fusco, 46 years of experience and 10 years of fiber mix.